Hi, my name's Emma Zurawell and I am the Melanoma Telehealth Nurse Manager at Melanoma and Patients Australia. So catching melanoma early is important for everyone, but it's especially crucial when you live in a regional, rural or remote area. When travel takes time, even small delays can add up, so finding melanoma early gives you more room to move.
Hi, my name is Sue. I'm from Bundaberg, which is in regional Queensland. In March 2024, I was diagnosed with an aggressive nodular melanoma. Since then, I had 12 months worth of immunotherapy, plus I had surgery to remove 26 lymph nodes and the wider excision of the mole on my back. Since that time, I've had no evidence of disease. I finished treatment 12 months ago and I'm healthy, living my best life.
Early detection often means simpler surgeries, less complex treatment, and fewer long trips. Finally, early detection also reduces stress. When you live far from services, waiting for appointments or results can be especially stressful. Finding a spot early often means smaller procedures, faster recovery, better outcomes, and less disruption to your life.
One of the things that is really important is to check your own skin. Be aware of all your spots.
So when people are conducting their own skin checks, they should follow the ABCDE skin check guide. This is a simple guide that is easy to follow. It's important to note that you only need one of these to seek further assessment. So we'll start with A, so that's asymmetry. So one half may look different to the other. B is border, so edges may be uneven. C is colour, so there may be more than one colour or a colour that seems unusual to you. D is diameter, so it may be bigger than 6 millimetres. And E is evolving, so any changes such as size, shape, colour, itching, bleeding or crusting. It's important to note that not all melanomas follow this ABCDE guide, so also look out for a new spot that stands out from your other moles, a sore that doesn't heal, a spot that bleeds easily, a lump under the skin near a mole that becomes itchy, painful or tender, or a funny looking spot that doesn't match the rest. The bottom line is, if your spot worries you, it's always worth getting it checked. When you see your GP about a mole or spot you're worried about, the appointment is usually simple and focused on what has changed. Your GP will usually ask when you first notice the spot and how it has changed. Examine it closely with a dermatoscope, which is a special magnifying light. Check the rest of your body for other spots or lesions and decide whether it's safe to monitor, whether the spot needs a biopsy, or whether you need to be referred to another specialist. If the GP is concerned, they may do the biopsy on the day or book one soon after.
I had a mole on my back I'd had forever, as long as I could remember. I happened to notice in the mirror one day, oh, that mole's really grown and it had changed. I actually had an appointment for a skin check because I had a scaly patch on my face. By the time I got to go for that skin check, the mole on my back had started itching and was really sore. The challenges I faced accessing a GP and specialist was more communication. I'm lucky the practice I go to has a skin check specialist there. It just took weeks to get into him because he's very busy. So from when I made the appointment till the time that I actually saw him was about 6 weeks. When you have an aggressive melanoma, that's actually a long time. Once I did get my diagnosis, he referred me on to a specialist who I actually saw within a few hours. So that was lucky. Everything went really fast from when I saw the surgeon. I actually was having treatment within 3 weeks of having my first, getting the results, which was really quick. I was lucky. I live in a regional centre where there are surgeons and there are doctors who do skin checks and so forth. People who live in rural areas and that, they don't have that luxury. They have to travel long distances.
Having difficulty getting in to see a GP can be a challenge for regional, rural and remote communities, and there may be ways to be seen sooner. You can try letting the clinic know that the spot has changed or looks suspicious, and they may prioritise you. You can ask if a nurse can take an initial look at the spot. You can also use telehealth to show the spot or send photos. Or there may be a mobile or visiting skin clinic in your area. If the spot is bleeding, growing quickly, or really worrying you, tell the clinic. Urgent symptoms often help you get an earlier appointment. After a melanoma diagnosis, the next steps usually follow a clear pathway. Your healthcare team will guide you through each stage. Most people will need a wide local excision to remove extra tissue around the initial biopsy. Some may also be offered a sentinel lymph node biopsy to check if the melanoma has spread. Your melanoma will be staged, so this helps to determine whether the melanoma is early or advanced. It guides decisions about whether you need surgery alone, additional scans, referral to melanoma specialists, or drug treatments. Depending on the stage, you may be referred to a dermatologist, a surgeon or plastic surgeon, or a medical oncologist. Your GP stays involved throughout and helps coordinate your care. There is a helpful document called the Melanoma Optimal Care Pathway, which outlines all of these steps. Melanoma Patients Australia also has some helpful resources on their website that go into further detail.
The treatment I had was immunotherapy, and I was lucky enough to be able to have that in Bundaberg. When I had my wider excision and the lymph nodes removed, I had to travel to Brisbane, and I was in the hospital down there for 15 days. That was a lot different. I had no family down there to visit me or anything, so it was a little bit isolating. The emotions that came up during diagnosis and treatment were surprising. It's very hard facing your own mortality, and the whole 12 months was quite an emotional time. I suffered a lot from fatigue from treatment, and when you get really tired, your mind can go to quite dark places. I had to work hard to not let that happen. You're scared a lot of the time. You don't necessarily have a lot of people to talk to. That's where the support groups come in, because the people attending them, they actually understand more than what family and friends can, as much as they try. But yes, it is a very emotional time. What helped me cope was being positive. I had to try and stay positive all the time. I had to block out negativity. It's amazing how many people you run into and they'll say, "Oh, I hear you've got melanoma and you're having immunotherapy." Well, that didn't work for my cousin. Well, do you know what? It works for a real lot of people. I was lucky enough to know 2 people quite well who had had immunotherapy for melanoma only in the months before I was diagnosed, and I got to chat to them and hear their remarkable stories. Plus the medical people I saw all were telling me how immunotherapy was the biggest advance in medicine in the last century. There's lots of positivity about it, and you just have to focus on that and leave all the negative stuff out. I just ended up staying away from negative people. I still do.